I've lived a lot of life. I admit that I had a lot of mental health struggles, especially when I was younger. But the thing that always pulled me through was hope. So I always had hope for the future. So when I was bullied, obviously it was very devastating as a young child. And that didn't stop in elementary school. I was on and off for most of school, which is fine. I've had counseling, I've dealt with it. But the thing that always pulled me through is like, well, why am I here? Like, what's my purpose on earth? And so if people are being mean to me, like, but why? Why is this happening? And I would feel down on myself and I would just pull myself through and like, you know what? No matter what happens to me, I should be grateful. I am healthy. I am able bodied. I am cognitively intact for now. um, I think the thing that has just always pulled me through that I should be grateful for what I have.
Welcome back to Hear Me Out with Belinda. Before I introduce today's guest, if you're enjoying the content of the channel, please don't forget to like and subscribe. Today, I'm going to introduce you to Jessica Tsang. She is a nurse practitioner. Welcome in our studio, Jessica.
Thanks for having me.
Okay, so nurse practitioners, I've only heard the term very recently, probably in, I'd say, the last year, actually.
Oh, wow.
I know. And so, and that's okay. But why don't you tell me how you become a nurse practitioner?
Sure. So nurse practitioners were created back in the 60s to meet address the needs of the community. There are a lot of people where they can't access family physicians. So the health authorities created the nurse practitioner. And they're registered nurses with additional training. So I have a postmaster's diploma as a nurse practitioner. And so it's 4 years to get your bachelor's degree. Then you need some experience as a registered nurse. And then you get a master's degree. Usually it's a 2 to 3 year program to become a nurse practitioner after your bachelor's.
Right. So it's actually education-wise, you're looking at about, 7 years there of education. And then
Oh, yes.
obviously some experience as well.
Yes.
Yeah. Um, and then you are a primary care provider.
Yes. So I have a concierge medical clinic that's based in Alberta. We have locations in Calgary, Central Alberta, and in Edmonton. And we provide primary care, which can be provided by family physicians or nurse practitioners.
Okay. And so would people be coming into your clinic or do you go to do home visits?
We actually have both. So when I started my clinic 9.5 years ago, I, again, really wanted to figure out how I can create, I wanted to increase access to healthcare. I had a lot of clients that I saw in the hospitals and with my other jobs where they needed access to medical care and they had some reason why they couldn't go, whether it's a physical barrier, mental health barrier, or even just transportation barriers. So I figured one of the solutions could be as simple as providing house calls. So that's what I started way back when. It's a house call company. And because we've had an increase in demand for just our services because people love our approach so much, we have opened up a clinic space. Our grand opening is coming up in
Oh.
June. So we're very excited for that.
And that will be in Calgary.
Yes.
Okay, that is exciting. And so when a person calls on you for service, and you're going to go make that house call, is that covered under Alberta Health?
Unfortunately, it's not. So similar to home care is private services. So we're elevated or advanced home care. So yes, it is something that's not covered by provincial health care, but it can be covered by extended health benefits.
Okay, but if you have to order like an X-ray or blood work for some reason, that would then be covered with the person's Alberta healthcare card.
Absolutely. And the other fun thing that we do is while we're there, because the goal is to make it more convenient for people, we draw blood and we also have a mobile X-ray technician who can go to the house. So you can get your medical appointment, your lab work done, and your X-ray done without leaving your house.
Wow, that's pretty incredible, actually. And then half the services would be billed to Alberta Health, and they would just pay for like your actual home visit.
Yes. Yeah, they'd be paying for supplies and for people to actually go to the home. But the radiologist, as long as you have Alberta Healthcare, they can bill Alberta Health. Similar with the lab, we still deliver the blood work to Alberta Precision Labs.
Mm-hmm.
So those are all covered.
Wow, that's incredible. And so I'm curious to know how many nurse practitioners graduated, like in your year? Like how many nurse practitioners are out there?
You know what? We actually have I'm not gonna get the numbers perfect.
Yeah.
But I think there's only a few thousand nurse practitioners in Alberta that are licensed. We don't have a ton of us, but we're widespread. So nurse practitioners can work in hospitals, they can work in primary care clinics, they work in private clinics as well. So there's a lot of utilization of nurse practitioners.
Yeah. Like I said, I mean, it's no fault to the nurse practitioners. It's just not a term or primary care provider that I'd heard about until recently. And then I think like anything, when you hear the term or you know about someone, then you see it pop up everywhere. So I've just seen a local, nurse practitioner advertising services here in Okotoks. And actually I was watching The Pit, and there's a nurse practitioner as part of their emergency room team. I don't
Yeah.
think you've ever watched the show,
I
but
have not watched the show, but yes, nurse practitioners are actually more common in the States. Um, but I think they were both came into existence around the same time, but in Canada, back in the 60s, I think they were more in rural, like northern Alberta, where there really weren't access to family doctors. So people would be traveling hours to try to get medical attention.
Mhm.
Um, and so similarly with the States, they have nurse practitioners and physician assistants. But NPs there can bill Medicare and Medicaid.
Okay, yeah.
Yeah.
Maybe that would be the dream of the nurse practitioners here in at least Alberta, right? Is to be able to really, be part of that collaborative team and actually get paid for their services. Because if I think about it, if I think just about even the urgent care here in Okotoks, I've had to take my kids in, or even myself, when we've had a back injury or a fall or something. And the amount of people in there with an ear infection or the flu or something, really, because it's just no other options. There's no walk-in clinic, and they don't have a family physician, to see them. So we are sort of blocking up those emergency care facilities. Yeah.
So there have been initiatives from the government to allow nurse practitioners to bill the government. Gosh, that's something Trudeau announced years ago. The goal was by 2026, nurse practitioners across Canada would be able to bill provincial health.
Okay.
Uh, that is not the case right now. There's been a bit of a delay while they're figuring out the administrative aspects of things. There are grants in Alberta for nurse practitioners. For some nurse practitioners, they are covered by the government through a grant.
Yeah. So that's exciting. So there could be some positive changes coming then in the next year. Maybe we could hope for a couple of months, but I don't think the the administration ever works that quickly. So that's really exciting. So then tell me a bit about if you're going in to see person and whatever the complaint is, are you strictly like, okay, you have a knee ache, we'll get your x-rayed, we'll give you the medicine for inflammation and pain, get you back on your feet? Or do you try to look at sort of what caused that knee ache? Like was it a fall? Does a person have vertigo as well? Which I think is touching a bit on functional medicine, but like how do you build your practice?
Well, in our specific practice, what makes us unique, not only do we travel to people's homes, our appointments are scheduled in 1 hour long blocks. So that allows us time to dive deep, get to know our clients a lot better, understand their medical history, other things that are contributing to their health, which we commonly call social determinants of health. And so when we're able to understand the home environment, understand other people who are involved in care, and understanding the contributing factors to their health, it helps us build a better plan for them that is actually achievable, right? So if somebody has a knee ache, well, let's dive deeper. What caused this knee ache? But how reasonable is it for you to get to a physiotherapist? Well, we actually have physiotherapists who can come to the house as well, so we can just call on them. They can come and visit you. But like it's understanding all the different things and putting the pieces together of like, well, is it just the knee pain or like what else is going on? My other specialty is actually pain management. So I do a lot of interventional pain management. Like we're trying to really increase access to different services. So I do ultrasound-guided injections in the home for people who have significant mobility issues. So we have a lot of elderly folks who have managed their knee or their shoulder pain for years with cortisone injections, but because of maybe progressive dementia or mobility concerns, transportation issues, it's really hard for them to get to the diagnostic imaging clinics. So why not just bring it to them? So I have my ultrasound, I have my cortisone, and we can do the injection in the house.
Wow, that's amazing. It sounds like you actually do a lot of collaboration with other partners within the, I guess, medical field as well. Let's say.
Yeah, well,
Yeah.
that's our goal. We're trying to be dynamic. I think that great health requires a team of people to be achieved, right? You need so for someone, especially if they're trying to age in their own home, you need your hearing tested, you need a physiotherapist, you need occupational therapy, you need someone to manage your diet, you just need so many people in the team who have a good understanding of your overall health and situation. That's how you create great health. That's how you age in place. That's
Right.
that's the magic recipe is actually getting a team of people.
Yeah, so coming into your home so that you're not having to leave that home and arrange special transport and making that a barrier to getting in.
Exactly. And yes, and when you need to go out of the home, like for example, so we can do consultations with specialists in the home as well. We can do that virtually because we can just set that up. But obviously, on occasion, there are times where you need to leave the home. But for many of our clients, it's a huge struggle to arrange transportation, arrange assistance to even get out of the vehicle and into the building to get on the assessment table. So why not just save those that hassle for when you really, really need it. Like, yeah, we're not cardiologists. So if you need to go get your stress test, please go and make those arrangements. But it's exhausting. Like it's a full day experience. And after that, the client and their caregivers are just tired. They don't want to have to try to coordinate blood work and all these other things after that. I'm like, no. So that's why we're trying to make it just really easy to at least get the basic medical needs addressed in a way that's super convenient.
That sounds great. And so tell me, just to get a bit personal, why did you become a nurse? And then why did you become a nurse practitioner? Like, what was that journey like for you?
Gosh, it's such a long journey. Um, so I mean, it started off when I was really young. I guess I didn't have a great experience in grade school. I was bullied. And I grew up in Saskatchewan in a small town, so we shared the school with other children who were cognitively or physically disabled. And so instead of going to the playground because I didn't have any friends, I volunteered to help feed and push my peers around the playground in the wheelchair. And that was my first experience of being like, you know what? I can provide assistance to other people, and this makes them happy. And it was just a nice experience to take care of somebody else. And obviously that just kind of grew and grew. So when I was, um, I guess in high school trying to pick my career, I'm like nursing just seems to be an appropriate step for me because I love helping people. I love bringing joy to others. And it's such a diverse degree to have because as a registered nurse, you can pretty much work anywhere, right?
Yeah.
You can work as a Canadian registered nurse, you can work anywhere around the world pretty much. You can work in all these different fields and all these different environments. And then when decided to become a nurse practitioner, like, there were so many experiences that I had where I worked in the hospital. So my background, I worked in ICU as an ICU nurse. I worked in urgent care. I managed a home care company. I taught nursing for the university for 10 years. Um, my background is quite diverse, and I've only mentioned maybe half of my experiences. Um, but when I worked in the home care realm. I saw that there was such a need for people. Like, we would be calling an ambulance for reasons that did not really require emergency services. It would be someone who had mobility concerns, so they're bedbound and they had an earache, but there was no way to get them to the doctor's office, so we called an ambulance. And so for this person who's bedbound, they waited 12 hours in the emergency department to find out that they had an ear infection and get an antibiotic. Um, and then we had to figure out how to get them home because the ambulance only takes them there. Then we had to figure out medical transportation to bring them back. And I kept seeing this same pattern over and over again of people were either reluctant to go to the hospital or go to the doctor's office for a variety of reasons. Um, and then I met I met a nurse practitioner and I worked with some of them, and I'm like, "Oh my gosh, they're amazing," right? They have the bedside manner of a nurse, the experience of a nurse, but they have these elevated, licensing so that it allows them to diagnose, prescribe, and order treatments. Like, this is obviously the next step for me.
Okay.
So, yeah, that's why I became a nurse practitioner.
Wow. You know what? I'm going to go back actually, if you don't mind, and you can say pass if you're not comfortable sharing. But you had mentioned you were bullied in grade school, um, and that probably shaped your life into becoming a nurse, right? Have you addressed that bullying? You know, like versus like how it's actually really impacted you as an adult, or do you feel like those traumas still come out in you?
Um, I mean, I've lived a lot of life. I admit that I had a lot of mental health struggles, especially when I was younger. But the thing that always pulled me through was hope. So I always had hope for the future. So when I was bullied, obviously it was very devastating as a young child. And that didn't stop in elementary school. I was on and off for most of school, which is fine. I've had counseling, I've dealt with it. But the thing that always pulled me through is like, well, why am I here? Like, what's my purpose on earth? And so if people are being mean to me, like, but why? Why is this happening? And I would feel down on myself and I would just pull myself through and like, you know what? No matter what happens to me, I should be grateful. I am healthy. I am able bodied. I am cognitively intact for now. um, I think the thing that has just always pulled me through that I should be grateful for what I have instead of feeling sad about the external things that around me that made me feel sad about myself. I need to appreciate what I have. And all that gratitude just continued to propel me to be like, well, I'm grateful for what I have. I think it's up to me to help share that with other people
Yeah.
and help spread that um, joy and positivity because the world is sad. Like, right? There's tons of people who are unkind out there. And I don't want to be that way. I want to be the person who combats it and says, no, like
Yeah.
we should be grateful for what we have and we should just spread it as much as we can. And that's how we make the world a better place.
Yeah. I did share on a previous podcast actually with my life coach. And it was funny how it just actually came up very sort of organically. It wasn't meant to be part of the conversation on that day, it was, the same thing. But I was bullied when I was 12 for an entire year. Short version was I had gone to high school, like was out of community. So the two sort of feeder schools, I was the only one there that didn't know anybody from, that what we would have called primary school in South Africa. We started school in January, after a couple of weeks, I had a boyfriend. A couple of weeks later, I broke up with the boyfriend because really, I mean, at that time, we weren't passing notes in class. We weren't spending break time together or anything. So I thought, we should just be friends. And I said that to him, I think we should break up. And then he had said to me, you'll regret this. And then the next day he came to me and said that, I'll call you ugly every single day for the rest of the year. And he did. He came up to me every single day and said, Belinda, you look like ugly today. And that was a lot. That was, probably from March till December. And because I'd actually never missed for 7 years of primary school, I had gone to school every single day. It was very militaristic in the upbringing. Even when I had whooping cough in grade 2, we were still like nebulized and then sent to school, which was and that was the advice the medical team and the principal gave my mom, right, is send her to school. So it didn't even dawn on me not to go to school or to try and skip school. Like I had to show up. So I didn't actually realize until that conversation recently how much it's impacted my life, right? The self-doubt and having what we call performance confidence. So I can show up with a smile into any room and I almost expect people not to like me or to be saying, oh, Belinda looks ugly today. But what I don't have is a confidence to be myself, right? To be my authentic self and show people who I am inside. So, and I think that I know, well, I've been dealing with the Foothills Community Coalition. We've mentioned Okotoks is really in need of a youth hub. There's a mental health crisis in Okotoks, which I don't think is unique to Okotoks. I think it's, throughout Alberta and the world, actually. And I think women like myself and yourself, that are successful, that have been bullied, I think it's so important to share our stories and to give hope, like you just said, to give hope to that next generation that is being bullied, right? Because they don't know, what happened to us. And if we don't tell them, they don't know that they can overcome it as well.
Absolutely. Mental health is such an important topic. Um, so the other interesting thing of our clientele, or I guess our patients, the majority of our staff actually have a mental health background. So yes, we provide primary care, but the reason why our appointments usually take an hour or longer is because we provide so much emotional support for the patients, for their family members, because we know that mental health is just a huge, essential aspect of our overall physical health. They've done studies where stress is actually the number one cause of the majority of diseases. And stress, yes, stress is kind of this blanket statement, but depression, anxiety, um, that all accumulates as stress.
Yeah.
Uh, so it's such an important thing to address. Like, one of our team members is actually a mental health specialist. So she does a lot of mental health consultations across Alberta, because we know that depression, anxiety are just, it's rampant, and it can be debilitating. It's so important to address that. And that yet there's still, despite how much anti-stigma campaigns there is still so much stigma about people having mental health concerns. And a lot of it, I do think, comes from the self-doubt of that's part of the that's part of the that's part of the disease, is this depression and anxiety. It just fosters this self-doubt, and it makes people feel worse. And that's what stops people from reaching out. And that's why it's essential for people, everybody, to have a really good connection with your primary care provider, whether that's the family doctor, nurse practitioner, or whoever is in your health team. Because when you have a trusted health professional, you and them can actually talk about that, right?
Mhm.
I have to admit, I've been feeling really down lately, or I haven't been sleeping lately. I feel like my anxiety is actually causing this rash, or it's worsening my back pain. And it's absolutely true. So yeah, mental health is just so important that I think it should be part of every single health encounter,
Yeah.
is to have some aspect talking about mental health, of just truly asking, how are you doing? How are you coping?
And when you spoke about your clients, do you find that the mental health is impacting more seniors? Because I think you indicated, I mean, you do work a lot with mobility seniors. And so there's still a mental health crisis in not just our youth, but then in our seniors as well. Would you agree with that?
Oh my gosh. It's all ages, right? It's
Yeah.
all ages. It's all stages of life. Starts with children, teenagers, young adults, where it's they're starting work, but they're uncertain. They're young adults in their skin. Um, and then, mothers and new parents, of the anxiety of raising children and being responsible for other lives. It keeps going, right? Every single stage of life, there's different stressors. And if we're not coping with those appropriately, it will continue, and it'll grow into a mental health concern. And yeah, all ages, but seniors, unfortunately, I don't think it's addressed often enough,
Hmm.
right? There is a sad reality when people are in their 80s and 90s and they start watching their friends and family die. The Yeah, the reality of death is it can be quite disheartening, and it can cause depression that, honestly, pills can't fix that, right? So I do think that there's different ways to think about death, but you have to be comfortable talking about it. And yeah, that just it's such a long conversation to have. But yes, seniors, I don't think their mental health concerns are addressed often enough. And sometimes they're in denial because they come from the generation where they're not comfortable talking about their feelings. And so that's the beautiful thing about having these long, hour-long conversations with people, is you can talk about mental health without directly talking about mental health.
Yeah.
You can just talk about it like, "Okay, well, tell me what happens when, um, you have difficulty sleeping,"
Mhm.
or tell me what you do when you feel like your blood pressure is a little bit high. And then you actually start uncovering these maybe unhealthy coping mechanisms, like going into a pill box and
Yeah.
grabbing pills because they have a little headache, or they're like, "Yeah, I feel like my blood pressure is high." But sometimes it's actually anxiety coming out in, physical symptoms.
I think I'm a registered hearing aid practitioner, so I have my own clinic here in Canada. And there's been a bit of a shift in the last few years with the studies on dementia and the links associated. And so that important of, making sure a person treats the hearing loss so that they help support cognitive function, but also so that they don't get anxiety and they start to isolate or get depressed because they're not interacting, they're not having those connections with other people. And so going back to, to our seniors and stuff, I actually bring up, I thought about a lot during some of my seniors during COVID. And I'm not going to debate lockdowns or anything, but it was heartbreaking to hear them come into the clinic and they weren't going to be able to celebrate the holidays with their family. They were going to be on their own. So that whole isolation. And some of them didn't have the ability to do virtual or Zooms or anything. They just didn't have that either the capacity to do it or the know-how, and there was no help available. And the amount of them that said to me, if this is life, I would rather die. You know, um, and I think that obviously there was unique situations within COVID, but the same thing, if we're not keeping people connected, if we're not communicating, if we're not having open dialogue with each other, that isolation, it just is hitting that anxiety and depression as well.
Yeah, absolutely. Isolation takes lives. It does. We see it often where couples who've been married for decades, when one spouse passes, the other one, it's not that long until they pass as well, because it's their person, and I love it. It's so sweet.
Yeah.
But you also think about the people in their 80s and 90s. Like, think about what they've lived through. Think about the traumas that have happened, and they've lived through that, and yet so many of them don't talk about it because they don't think anyone wants to hear it.
So I just wanted to share one last story about my grandmother. So she was a nurse in the Second World War, based actually in Egypt, and then she married someone and moved to would be the Copper Belt in old Rhodesia or Zambia. And we used to spend a lot of time talking. She was actually really open about the bombings and everything else. But what I remember is when she was 85, she had to have one of her kidneys removed. And she had just come out of ICU. She was in a special ward. And I went in and, she needed water. And I tried to, lift her up. And she was like, "Put that down. I will do it all myself." And she wasn't trying to be mean, but I think like her generation had just struggled so much of having to do everything on their own. So living through the war, seeing all that, she had married someone who unfortunately did struggle from PTSD. Um, she worked in an alcohol abuse center for war veterans and stuff. And so she couldn't actually accept the help. And so even though she was very open about talking about her experiences, and maybe that helped her. But I think it is interesting to think about these seniors and their life experiences, and that they haven't been taught. And they, to number one, ask for help, and number two, to share their experiences. So with that, I'm just saying, I think we've lost Jessica. So I'm going to end off the joys of technology. So thank you for listening. Thank you to Jessica for being part of the show today. And I look forward to seeing you all next time.